10 states have now moved to get back to business. Restaurants allowed to serve dine-in customers again in states like Georgia and Tennessee. And U.S. death toll soars to over 50,000. Some states seeing their deadliest days yet. Cases now surging in the heartland. And the cases in America. The pandemic has now killed more Americans than the Vietnam War. But healthcare workers fearing it's all too soon.
If we reopen too quickly, everything is just going to spike again.
In 2020, if a person contracted COVID-19, on average, they would spread it to 2 or 3 other people. Those 2 or 3 other people would, on average, spread it to another 2 or 3. And so on, and so on. 1 out of every 200 people who became infected died. In 1 year, this virus killed over 2 million people worldwide.
Good morning. Good morning. Don't worry, I've got allergies. Good morning from the allergy coast here in Stamford. Good morning. Good morning. I wanted to give everyone an update. It's pretty windy out here and it's raining. Last night I gave a little periscope on the future of where we are at and where I think we will be. Today in the morning I want to give a practical update about where Murphy Medical Associates is and what we're doing. We're still hammering out the details in New Haven, but I think next week is going to be a go. We'll be in a neighborhood that absolutely needs testing. It's a neighborhood that has a bus line. They can't get to a drive-thru. And it's not fair to just have drive-thrus. I think we have to have walk-throughs. And so our team at Murphy Medical Associates is dedicated to serving those who need it the most, who have least access to care. And so we're planning a whole new strategy with walk-throughs, not just through the city of New Haven, but also several other cities in the state of Connecticut. We're also actively been approached by towns in New York too. And so we'll begin our move northward and eastward. I'm very excited about that. In terms of testing strategies, we are validating a new saliva test. But guess what? I still have the same concerns about reagent availability. And the manufacturers in Canada have said they've ramped up production. Well, guess what? Now it's time to man up, Origin. Let's see where you're at. I'm really excited about this test because theoretically, we could deliver it to the homes of everyone in the United States. And I want to talk about our home here in Connecticut. The governor has said you cannot charge patients for these tests. Currently, there's a lab out there charging patients over $100 to get an at-home nasal swab. That won't happen in Connecticut. The patient should not be charged for these tests. It creates a barrier to identifying the people who have the novel coronavirus. Okay? So what we need to do is we need to bill their insurance companies or file away the claims and wait until the governor has grant access for us to get our payment. We'll get the payment. It'll just come later. That's all. Listen, a lot of landlords are in that position right now. We'll get payment, but a lot later. And that's what we have to do with each other. We have to cut each other some slack. And the citizens of Connecticut, they need all the slack they can be cut. Okay? End of story. So, I want to give a little bit more of an update of where we're at. All right? The governor of New York said that around 21% of people are producing IgG antibodies. I got to tell you, our numbers are not like that at all. As our numbers of IgG roll in, we find out that a lot of people who were positive for novel coronavirus are not making antibodies. They're not making antibodies, and we can see that. So we'll continue to test till we have a more robust sample. I believe the governor had 4,000 samples. We'll work to get 4,000 samples too, and then we'll share our numbers as well. Lastly, lastly, I want to tell everyone about the data that came out about ventilators. If you're on a ventilator, you're in bad shape. We know that for 10% of all the patients that are infected, 10% of them are going to have it the worst. They're going to be on ventilators. And unfortunately, the death rate on ventilators is around 88%. I think they said 88.1%. I have to tell you, I believe that data. Unfortunately, that's what we're seeing around the nation. The hospitals that share their data with me are pretty crystal clear. You don't want to be on a ventilator. So how can you avoid that? Well, my name is Take Weight Off MD. One of the first things you can do is if you're overweight, it's time to start modifying your eating strategies. Okay? The first one of those is you got to cut carbs. You got to peel down the carbs. Number two, you need to consider intermittent fasting. You should consider intermittent fasting. It's a great way to lose weight. All right? The third thing is exercise, activity, including weightlifting, okay? Building muscle mass is going to be the key here because patients that are obese end up on ventilators and patients on ventilators die. And that's what I used to do in my past life, help people lose weight and get healthy, all right? End of story. So I want everyone to try and do that. Work on some intermittent fasting, cut the amount of carbohydrates, especially the simple sugar carbs, cut them out, okay? They're not good for you. No juice, no soda, water, milk, coffee, okay? Maybe some bone broth. Stay away from the sugary stuff. It's not good for you. That's Dr. Murphy's preventative care tip of the day. I love you guys. I hope you have a great day. We're advancing in all fields. We're taking recruits. If you want to volunteer, go to coronatestct.com and sign up. coronatestct.com and sign up. We can use all the help we can get. Medical students from all sorts of schools are flooding in. We need all of you. My brothers and my sisters in healthcare, respiratory therapists, PTs, nurses, MAs, LPNs, RNs. I could name all of you. We need your help. MLTs. We now are getting COVID tests in our office. We're going to start doing rapid turnaround testing in our lab. MLTs, come on board. We need you. Pharmacists, we need you. coronatestct.com. That's coronatestct.com. This is Dr. Murphy signing off, right, with Murphy Medical Associates. We love you guys. Have a great day. Have a great day. We'll talk to you soon. Bye.
So, good morning, everyone. How are you doing? Yeah, big deal. Vanity, I think, is gone out the window here. Good morning. Good morning. I hope everyone is enjoying this fine Saturday morning. I don't know about you guys, but I'm very happy with how my Penn State Nittany Lions did in the draft. We've got KJ Hamler going to the Denver Broncos. Yetur Gross-Matos is going to the Carolina Panthers. Two probably my favorite players over the last couple of years. So they got in, they got the draft. What are we going to do? I think I talked about the future and sports. That's LabCorp leaving me a bunch of results. I talked about the future in sports with coronavirus in the last future talk. So I think I'm going to talk about the future and restaurants this time. But before I do any of that, I want to talk a little bit about immunology and immunity, right? I'm really surprised a lot more immunologists have not gotten online and started to talk about what these antibody spreads mean and what they can tell us. Well, the big thing we looked at is something called a memory type of immunity, which is IgG. Well, I'm here to tell you right now that this virus has given us some confusing results. We've done our first week of IgG testing and monitoring, just like the governor of New York did. Now, we were testing positive patients and patients who thought they had exposure to the virus. Here's what we're finding. Patients who were really sick most of them, 85%, are making IgG. These are people that go in the hospital or who needed telemedicine visits daily with elevated levels of inflammation. These people made IgGs. Okay. We have a whole subset of other people who are sort of sick. They didn't make IgGs. And so a significant portion of them, more than the majority, did not make IgGs. And then I have a very confusing subtype right now, which is patients who are currently very sick in the midst of this, very early on, maybe early on for my detection, who are making IgGs. They're making IgGs, but they can't shake the virus. They're having a hard time fighting it. And so that's an interesting dichotomy. We assume that you convalesce, you get over the virus, and you make IgGs. Well, you can make IgGs during acute infection. And just because you have IgGs, I don't think it's a prognostic factor saying you're going to get over the virus easier or earlier. I don't think we can say that. And interestingly enough, we will only know whether true immunity is conferred when we re-expose someone who doesn't have the virus, but does have IgGs, to virus. And that's how we'll know whether it is a true immunity test that we have. There are a lot of different platforms out there. Quest, I know, is using the Abbott machine. The Stanford Hospital has a really great Abbott setup in one of the local hospitals that we have. I know the Yale system is working on their platform as well, as they all get ramped up. As you know, I have my own laboratory, but hadn't been able to secure any reagents, so we couldn't do any coronavirus testing. That's about to change. We now have coronavirus testing. So we were doing biofires, which is a respiratory panel to look for flu during flu season or upper respiratory season. We still continue to do that. But now we can also test for coronavirus. And so I'm pretty happy about that. We've secured a significant amount of reagent to rev up our lab, so to speak. We had to wait. We were third in the pecking line behind the Department of Defense and hospital systems. So here we go. It's time to go with testing. The more testing we do, the more we know. And I believe this also is true with the immunoglobulins and the IgG story. That's the IgG story: to test, treat, isolate, and treat. All right, good morning again. Just that hair, it's all over the place. So LabCorp just had to give me a large amount of positive results. We are still seeing a large amount of positive results. New diagnoses all the time. They are happening. I'm gonna grab a little coffee, right? It's like what's his face there that gave the counter speech, had to grab some water. So here's the deal. Lots of conflicting data. We don't really know what's going on. We're still in the fog of war. We're still in the fog of war. To the military vets out there, I'm not saying that, we're getting shot at like you did in war. That's not true. But a whole lot of us on our front lines are getting sick and suffering and dying. So there are some comparisons that are reasonable here. We try our best to protect ourselves from the virus with PPE, just like you would with Kevlar and flak jackets and good gear and keeping your head down. We're trying to do the same thing. Granted, it's not a hostile enemy nation that's attacking us. Instead, it is an invisible enemy. And so I will say, for a lot of people who are frustrated about the war analogies, it is very similar to war. And like those vets who suffer from PTSD, we're going to have a whole host of nurses and doctors and respiratory therapists and PAs and charge nurses and unit clerks and everyone you can imagine that are going to have the same PTSD. And it's a shame that the veterans are now treated better and get better services for these sorts of after effects of war. So there's no doubt about it. And these are very similar comparisons. Okay, back to the future. We're going back to the future, and we will. And I think that in our future, there are a couple other things I wanted to talk about. The first one is restaurants. It's important. What is a restaurant going to be like in the future? Well, a couple of things we need to know. We need to know who's infected. We need to know who's quote unquote immune. Currently, we don't know who's infected and we don't know who's immune. I can tell you this. There are Chinese studies that show that in restaurants, the ventilation systems spread the virus. They found virus in the ventilation ducts, up, down, and over. Okay? So the ventilation is an issue. So what do I think is going to make sense? Open air cafes. Open air cafes, very similar to our open air Corona Care, CT.com, care pods, open air cafes. So I think there are restaurants with open air with tent coverings. I think that is definitely in the future for restaurants. I think it's definitely in the future. The problem with a restaurant is the following. You assume a certain cost estimate to price your food items to make your restaurant successful. That assumes a certain density in your restaurant. If you can't have that density, because of spread of virus, you're going to have to readjust the magic number, right? What's the magic number? Take whatever the food cost is and divide by 0.35. That is the minimum you can list your food for as a restaurant at restaurant prices. Well, now, if we've spaced the tables apart at least 6 feet and probably further, I think restaurants are going to go down to a third of the capacity. A third of the capacity. So we're now looking at a 9x to 10x cost to operate restaurants. So if restaurants do come back into business, I think that it's going to be 10 times as expensive. So this means a tripling in costs to operate currently. So that ribeye that was $30 is now $90. That's a very tough sled for restaurants. So I think that there have to be some other strategies, including perhaps larger footprints. I think restaurants may need much larger footprints. And I think the first restaurants that'll be the best restaurants are the ones with open air seating. Maybe a tenting or those sorts of things, but with natural air coverings, which means that there's going to be a seasonality to restaurants. I think there will be a seasonality to restaurants. I think that there will be it'll be like the Christmas sales, except it'll be the summertime. It'll be a summer seasonality that will happen. And I think we'll see that. I think because people are not going to be moving around all over the place, you're going to see, I don't think the Hamptons will be as full, and I don't think New York City will be as empty. I think there's going to be less travel going on. I think the restaurants have got a tough sled. I think that they're going to have to focus on food, in my mind, that is healthy and worth the price. Unfortunately, that robs a lot of communities that can't afford the price from going to restaurants. And so we really need to think about how we take care of those who won't be able to afford the new face of expensive restaurants. There's going to be a whole nother business opportunity there that people are going to have to think through. I think part of that will include cooking in homes. And there's going to be a whole nother move for that. Enter the drive-thru pizza chain. There's a pizza chain that I know called Colony Pizza. Remember, I'm Take-Weight Off MD, so I'm supposed to tell you that this food's not good for you. Dr. Murphy with Murphy Medical Associates and coronatestct.com. That's coronatestct.com. I look forward to seeing you again tomorrow. Have a great day, sunny day. Get outside, get your vitamin D, get some air, Don't drink bleach. Good afternoon, everybody. It is Sunday, the 26th of April. We are 2 months into the Grindhouse, and I want to thank everyone for joining me at coronatestct.com. That's coronatestct.com. I wanted to give you guys some updates for the week coming ahead. We have had, yes, there you go. My kids telling on the other ones about needs for brain break. And, you know, the kid thing is a really good reminder of tattletales and those sorts of things. You know, before I tell you about the updates that I have, what we'll do is we'll talk a little bit about the healthcare system. I want to give everyone kind of some insight. Right now, it's a mess. So if you're a big group with heavy overhead, or you're a hospital with massive overhead and like a 4% margin or a 3% margin, you're dying. Right now, you're dying. And let me tell you why. Because a lot of these big groups and doctors, practices, hire a bunch of specialists that make a lot of money. The primary care docs, they don't make a lot of money relative to other doctors. In relative to society, they do okay, right? Primary care docs do okay. Could they do better? Yes. Should they not have massive $500,000 worth of loans? Yes. But yes, it's tough to service debt on a primary care physician's salary. So the primary care physicians are having a hard time. Right now, there's a massive workload placed on primary care physicians that are in the field working in ERs or in ICUs, alongside of specialists and hospitalists. So they're shouldering the burden. The neurosurgeon or the orthopedic surgeon, not so much shouldering the burden, except for those unique volunteers who have entered the fray and decided to do ICU or the surgical ICU doctors. So there are a lot of heroes in this field, but there are a lot of practices that are dying. And so that makes them scared. There's also a lot of big hospital systems that are losing revenue, and it makes them scared. And a good example, I applied for CT scanners to identify pulmonary emboli in COVID positive patients on the outpatient setting. Let me tell you why. Because pulmonary emboli kill those patients. And there's only a few ways to detect it, right? One is you do a blood test, which a lot of places aren't doing, which currently we are doing at coronatestct.com. And that's just to give you an inkling of maybe you might have a blood clot. There's ultrasounds of the legs and the vasculature to look for microthrombi. And we're doing those ultrasounds at coronatestct.com, but they have to be outdoor ultrasounds and open air safe ultrasounds. And the weather's been really bad, so we can't do them as often. Lastly, there's the CT scan, which is the gold standard for finding out pulmonary emboli in the lungs. Right, that's the gold standard for finding out pulmonary emboli in the lungs. It also enables you to detect a COVID pneumonia, which is ultimately also killing these patients, COVID pneumonias. The treatment's not there, but the warning is to say, oh, you better watch this person. They better go home with oxygen, or they better go to the hospital. So those clinical decision tools are assisted with CT scans. Well, I put my application in, and the Connecticut Society of Radiologists, whoever the heck that is, it is a shell group for a bunch of doctors who were terrified at the thought that we would be able to do CT scans. And they wrote a huge diatribe about how we would self-refer, and it basically made us sound like pirates, when in the end, we're the only guys running into the burning building here of outpatient care. And that's what's going on with doctors. So they tend to attack each other. They've been put into fiefdoms. And they hold political grudges. They hold grudges. It's horrible. It's like a bunch of little kids. And in this case, we've tried to stay out of that fray, right? We've tried to, if a town comes and asks for a drive-thru, we set it up. Will it make other practices mad? Who cares? This is about public health. Will it make them jealous? Maybe. Who cares? It's about public health. Will it kill their practices? No. We're doing drive-thrus, right? We're taking care of patients. If they would like to take care of patients and do drive-thrus, we welcome them. They should come to us. We'll give them the plan like we did with New Vance Health. And New Vance, again, is doing a great job with their drive-thrus because they came to me and I handed them the plan on a silver platter. They modified it a little bit for their needs, and they're doing a great job. Imagine if all the other practices raced out there and did the same thing. We wouldn't have any issues with testing. It would be fantastic. But there are always politics involved, and unfortunately, that leads to worse outcomes. So it reminds me a lot of my kids. One kid telling on another kid to get another kid in trouble for political nuance and for jockeying a position. That just can't happen with a pandemic. That's foolishness, right? All that stuff needs to go out the window. So enough of my diatribe about practices that will speak ill to, survive. I'm sorry for them. I feel that everyone needs to pivot and focus on being able to care for these COVID positive patients, whether they're in underserved communities like we're doing in New Haven, or whether they are in rural communities, right? We're actively engaged in discussions up in Ridgefield, Connecticut, which is a little bit more rural than down, let's say, in Stamford, or in the city, all right? So our goal is to just bring testing and care to the patients to keep them healthy and hospital free, right? Our aim is to test, to trace, to isolate, and we need to do those things, right? We need to do them effectively. And the way to do that is you start by testing, because if you can't test, you can't do the rest, right? So as an aside, we've seen testing volumes across the board in Fairfield County start to slide down. Another testing site in one of the big cities came to me and they said, hey, we haven't tested anyone in 2 days. So can you bring some of your overflow maybe over there? I told them our volume was down too. And I think we're going to see a lot of reduction in testing volumes. And I think it's one of two things, right? Everyone is ambivalent and they just figure, we'll ride through this. Or they're scared to come out. I think those are the two issues. And in a state like Connecticut, where testing is paid for, the people even who have high deductibles, I get calls, are we going to have to pay? So there's probably fear about cost of test too. I know in New York State, it's not the same as Connecticut. It's a little bit different. So regardless, we need to test, we need to treat, we need to isolate, and we need to trace. If you can't test, you can't do the rest. So we're going to continue to do those things. So that's our antibody testing. I think I updated. We're going to have it in Stratford and in Greenwich. I'm hopeful we can get it in Darien and Stamford very soon. Okay? We're doing our ultrasound diagnostics to rule out PEs. Even though the state denied our CON application, there are other ways that we can try and figure out whether you've had a PE or not. They're not the gold standard, but they're pretty good ways. Unfortunately, when other doctors tried to block our CT scan application, the state listened. And that's a problem. Doctors interfering with public health is a big problem, and it's got to be stopped, right? We're all in this together. We need to pull all of this together. There needs to be no more tribe mentality. The tribe mentality is a problem. I understand you're scared about your revenue, but if you do the right thing and you take care of these patients, the patients will take care of you. The public will take care of you. The government will help, okay? That's what we have to do. We have to take care of our public. And no matter the conflicts that happen, we have to take care of each other. That's what we're here for at coronatestct.com, at coronatestct.com. And that is what I'm here for, Dr. Stephen A.R. Murphy. I'm committed to care for our communities, no matter the risk. End of stories. Okay? End of story. coronatestct.com. Dr. Murphy, I'm going to sign off. All right?
Good morning. Well, good afternoon, everyone. Good afternoon as we get ready to prepare the Day Street Park. Get ready to prepare the Day Street Park on the corner of Day and Chapel, right next to the Amistad Academy, where we will be doing our first walk-through testing center for patients who cannot drive. That is correct, on the corner of Day and Chapel. We're getting ready and we're preparing for our testing center here on the corner of Day and Chapel at the Day Street Park, right next to the Amistad Academy. I can't begin to tell you how much this means to me. How much this means to me. Born in New Haven, Connecticut, born at Grace New Haven Hospital, finally able to return and take care of the community and do what's right. Look, I'm like one of those governors. I missed one of my straps here. All right, so this is Dr. Murphy with Murphy Medical Associates. We will be opening a walk-through testing center in New Haven at the Day Street Park. End of story. This is great because it's between Dixwell and Dwight, and it helps two great neighborhoods. Dude, try and catch the virus. Then you'll see how serious it is, bro. Trust me, I've been in the hospital. I've seen people die. It's not such a big scam. All right? And the quicker we can prevent this through testing, treating, isolating, and tracing, we're going to be in a better place. All right? Trust me, man. You got to wait till your frontal lobes get all the way fried up, right? They got to get lined up, and then you can critically think. Trust me, I'm a critical thinker. This shit is real. It is real as a heart attack. All right. So it's Dr. Murphy with Murphy Medical Associates and coronatestct.com. That's coronatestct.com. Here outside of the Amistad Academy. That's the Amistad Academy and the Day Street Park. And the Day Street Park. We're here to test, treat, isolate, and trace those of us who need the care the most. We're here for you. It's Dr. Murphy signing off. Good evening, everyone. It is Monday, the 27th at 9 p.m. Thanks for joining me. This is Dr. Murphy at coronatestct.com. That's Dr. Murphy at coronatestct.com. I want to give everyone a little update. Today I was in 2 states, 3 counties, developing multiple sites, right? And there are multiple needs at different sites. We're entering the fray in the epidemic hotspot that started it all in New York, Westchester County. We are going to partner with the town of Bedford, the town of Mount Kisco. They've got to get some work done to set it up, but we're going to partner with them to help them stand up their own drive-through testing center in Westchester County. It's the first step. I also reached out to the mayor of Port Chester and offered him our help as well. Let me tell you why I reach out to people. So I didn't reach out to Bedford and Mount Kisco. They actually reached out to me. But I reached out to the mayor of Port Chester. Let me tell you why. Okay? In the city of New Haven currently, there are around 1,400 infections that have been detected. There's many more. And when we open our walk-through testing center on Wednesday at 1319 Chapel Street, we're going to find a whole lot more. There's no doubt about it. But in a little 2 square mile patch right next door to our offices in Greenwich, there's a town called Port Chester, New York. Port Chester, New York has 800 cases, 30,000 people, 800 cases. And that's because in that 2 mile stretch, people live close together. In areas where people live close together, they tend to spread the virus. It's just that simple. And that's why our testing center at 1319 Chapel Street is so important. The buildings all around it, multifamily homes and apartments where people live near each other, right? Right next door to the Amistad Academy in New Haven. Also, Port Chester makes an ideal location to do walkthroughs off of the train tracks, off of the rail station. And so the site in Bedford is actually going to be at Bedford Hills at the train station. If it's approved, and I think it will be, that's a no-brainer. I think we should do the same thing in Port Chester. And so I reached out to the mayor there. Hopefully he will see, hi, Linda. Hopefully he'll see that I answered my own call, right? Maybe I called him, and hopefully he'll answer the call for his citizens. And we'll go through that. So in addition to these things, we are offering blood draws
in our Stratford drive-thru. So we're going to be testing antibodies at our Stratford drive-thru on Wednesdays. We're going to try and scale that up and create what I like to call a Corona Care Clinic. Create a Corona Care Clinic in Stratford, Connecticut, which is it's like the jigsaw piece between Fairfield and New Haven counties. It's like a very essential piece of Fairfield County that most people in Fairfield County, honestly, don't call Fairfield County, but it really is, and it's so unique. It's a great town with Sikorsky in it, which is they make the helicopters. So we're very happy and pleased with our town partners. They've done such a great job. The city of Stamford continues to test its municipal workers on a 2-week rotation. I think that's a very reasonable rotation. In the United Kingdom, all first responders are tested every week. We actually had an incident where someone got a little hurt with a nasopharyngeal swab. So we have to say, the risk-benefit ratio, once you start to get to a week, it's kind of complicated. So here we go. This week, New Haven opens up. All right. At the end of the week, Bedford Hills opens up. Hopefully, Port Chester will engage us and we can help them as well. Stratford, blood draws open up. All right. We continue in Stamford. We continue in Darien. We've had some discussions about immunity testing in Darien. And I think more than anything else right now, to open up these towns, we need to come up with protocols. So I'm working with a couple of departments of public health. I'm also working with the president of the Westchester Restaurants Association. And we're going to try and come up with some guidelines, some best practices, or better homes and gardens, right? Or in the hospital world, they'll call it JCO, right? So the JCO requirements to open up a business during the time of coronavirus. All right, because I think there's some special needs that we have to consider in the time of coronavirus. And I think it's foolish not to consider them, because I don't think people are going to shop in shops. I don't think people are going to eat out at the restaurants without some consideration and some check boxes here, right? One of the big ones, you need to change ventilation. Well, you got to go through the town and you got to go through zoning. No! Is it a plan to mitigate coronavirus? Yes or no? If it is, you skip the other steps. You got to be able to deploy these things. And so that's going to require real will at the town level for restaurateurs, for shop owners, for business owners to be able to get these changes. And I think that's going to be very, very, very essential. Sorry, guys, it's a bunch of people are texting me right now. Then leave me alone so I can talk to you to let you know what we're doing at coronatestct.com. That's coronatestct.com. We're deploying new sites. We're helping the town of Bedford and the town of Mount Kisco start their own site. We're very excited about that. It's going to be a very good site for them. In addition to all of those, I talked to you about Port Chester and how they're having a really bad outbreak because of population density in a 2 square mile zone. 30,000 people, 2 square miles. 2 square miles is small, right? Greenwich has 60,000 people, and it's a lot bigger than 2 square miles. A lot bigger than 2 square miles. So all those people together make a natural imbroglio to have virus spread. And so I'll talk to the mayor again. I'll let him know. We're here for you at coronatestct.com. We're here for you to help you. Okay? In addition to all of those things, my oldest daughter came to me and she said, "Dad, when is this thing going to be over?" And I said, "Well, it may not be over for years." And then she said, "But the quarantine, when are you going to break the quarantine?" Like, I can control when the quarantine is broke. I was honest with her. I said at best June. At best June. I was thinking July 1st. The flattening of the hospital stuff has got me feeling a little bit better. But that just means that the people that were the sickest either died or they got discharged. And a lot of them died, unfortunately. And now that we're sheltering in place, our sickest are not getting exposed in the community. Where they are getting exposed and where it's really bad is in the nursing homes. In the nursing homes, there are dozens, if not hundreds of cases. And if you look all the way throughout the nation, the nursing homes really, really, really had the worst of this. Nursing homes, naval ships, cruise ships, assisted living facilities, anything that has a communal sort of feel to it, they really had a bad run. They really had a bad run. So we're trying to help them and test them and get taken care of. So that's our goals. That's what we're working on at coronatestct.com. It's Dr. Murphy. I'm signing off. I hope you guys get some rest tonight. Have a good night. It's a big day tomorrow. It's coronatestct.com. This is Dr. Murphy signing off.
Good morning. Well, good afternoon. I'm here with the City of New Haven Public Works Department as they set up our site. And as my brother Fernando here sets up the site, that's right, we can together, right? At 1319 Chapel Street, we will be setting up our walk-through testing center. Let me tell you a little bit about the neighborhoods of Dwight and Dixwell, okay? The neighborhoods of Dwight and Dixwell, unfortunately, are filled with people who cannot get access to adequate health care for whatever reason. In addition, the people of these neighborhoods have a higher proportion of African American and minorities that have worse health outcomes. We see that in the city of New Haven, that a significant proportion of COVID positive cases in the hospital, a significant portion of COVID cases in the hospital, there you go, are coming from African American populations, all right? And this is a big problem. A lot of them, unfortunately, are not getting tested. They're not getting treated on an outpatient setting. They have to come into the hospital a lot of the times because they cannot go to a drive-through, all right? They can't go to a drive-through. So the mayor's office here, Mayor Elliker and Director Bond, have decided to work with us, coronatestct.com. That's coronatestct.com, and our group, Murphy Medical Associates, to bring the drive-through to them. And that's just what we're going to do here on the corner of Chapel and Day, across from the Baptist Church. Okay? We are here to help bring coronavirus testing, novel coronavirus testing. We're setting up the park. We're doing a lot of work on the park right now. Okay? The Public Works guys are here. We're loading up our tents. We're getting everything ready to go. We'll be ready to see you at 8 a.m. tomorrow at 1319 Chapel Street. 1319 Chapel Street at the corner of Chapel and Day. See you then. coronatestct.com. It's coronatestct.com.
Good evening, everybody. It's like 6-ish something. I don't see the time. It's 6 something at night on Wednesday. That's how it goes. On Wednesday, the 29th of April. We have debuted our walk-through testing center in New Haven, in the neighborhood of Dixwell, and we're pretty excited about that. We helped a lot of people today. We'd like to thank the news for all being there for our debut. That's our coronatestct.com walk-through testing center, right in partnership with the New Haven MRC and the New Haven Department of Public Health. So I'm very, very excited about that. Again, I'll go back to it again and again and again. Public-private collaborations win the day. They win the day. So here we are with the New Haven Department of Public Health, setting up testing, coronavirus testing for the underserved. And I can't begin to tell you how many thank yous we received. It was a wonderful day. We're going to continue to do it every day of the week. Monday, Tuesday, Wednesday, Thursday, Friday. Unfortunately, because it's a walkthrough, we can't do testing in the rain. It's just not fair to the people that want to get the test. In addition, we can't do it in lightning storms, and we can't do it in hailstorms, and we can't do it in really high winds. Why? Because it blows the tents over, it knocks everything over, it's no good. But better days are coming. We will be testing 8 until 4, Monday through Friday, in New Haven at the corner of Chapel and Day. That's the corner of Chapel and Day by the Amistad Academy, their middle school there. All right, we're very happy. Our team is set up. We're ready to go. Next, on Saturday, we take the Murphy Medical Associates and coronatestct.com train over to the Bedford Hills train station, where we debut our Westchester services. We will be testing in Westchester County. This is our first Westchester County site. It's not that we haven't been interacting with the Westchester County Department of Health. We actually have. We're working with some of their key people to develop some guidelines for businesses to go back into business, especially restaurants. We think there's a really great need here, a social aspect, but also some health dangers. And we want to work with the Westchester Restaurants Association and the Westchester Department of Public Health to help come up with some guidelines. So, without further ado, I present to you the Bedford Mount Kisco Coronavirus Drive-Thru Testing Center located at the Bedford Hills train station. This will start Saturday at 8 a.m. We're also working to add a weekday, Tuesday. All right, so that's our goal. Saturdays and Tuesdays at the Bedford Hills train station. And I want to thank the town supervisor Burdick and Mayor Gina over at Mount Kisco. They are fantastic, and they've been a really great help to us at Murphy Medical Associates. So we're really excited about that too. So, with all that being said and done, I want to tell you where we're headed. The next phase of test, treat, isolate, and trace is treat. Okay? Treat and trace. Treat, isolate, and trace. So, treating. We have set up our care clinic, our care pod clinic for COVID patients in Stratford at 1000 Main Street. So I'm totally excited about that. We're replicating what we're doing in Greenwich. We're drawing blood work, including antibodies for patients who are COVID positive or who think they had COVID exposure or had the virus. Okay, to wrap up, New York Saturday, New Haven 2-day, care pods in Stratford. You can get blood draws. You can call, you can get ultrasounds. We can keep you healthy and prevent the risk. All right? The goal is to put the R naught to 0. Get the R naught to 0. One person infects no one else. That's the dream, right? So we want to keep it as low as we can. Pop-up centers are going to be the future of cohorting, of testing, treating, isolating, and tracing. And that's what we're here for. Okay? That's what we're here for. This is Dr. Murphy signing off. Linda, have a good night. Okay? Thanks for tuning in. coronatestct.com. It's coronatestct.com. You can register and get information there. We'll take care of you. All right? We love you all. Have a good night. Get some rest, Linda. You can sign up online. Come down to New Haven. It's not that far away from Bloomfield. All right. Take care, guys. Have a great night. It's Dr. Murphy signing off.
Dear Mr. Cuomo, I seriously doubt that you will ever read this letter, as I know you are busy beyond belief with the disaster that has befallen our country. I am a retired farmer hunkered down in northeast Kansas with my wife, who has but one lung and occasional problems with her remaining lung. We are in our 70s now, and frankly, I am afraid for her. Enclosed, find a solitary N95 mask left over from my farming days. It has never been used. If you could, would you please give this mask to a nurse or doctor in your state? I have kept 4 masks for my immediate family. Sincerely, Dennis and Sharon. How beautiful is that? God bless America.